So
how about patient now?
According to the last image, patient looked fine and she didn't feel pain. So I'm guessing everything went well.
That's good.
Yeah.
Very good.
So are we moving on to the Q&A session now?
Yes, that's good. That's right. Move to the question and answer from the audience.
Okay.
Okay, now the three speakers and finished their talks, and especially the last one, the Dr. Chen gave us a live demonstration of how to do the procedure from the beginning to the end. He did one case and totally 5 nodules, right? 5 nodules. And after ablated, gave the, check, injection some contrast medium, and we can say there is no enhancement. So very completely application. So it's good. Now we begin to the question and answers. Some comments or some questions, some comments from the audience. Please, Donna, please manage that.
Okay. We have some questions from our audience. First of all, is a question from Egypt doctor. How microwave ablation? How to do the microwave ablation on cystic thyroid nodules? 对囊性的甲状腺结节怎么做消融？
Okay, I think Dr. Chen, do you answer the questions? How to microwave ablation for the cystic thyroid nodules? 囊性甲状腺结节的微波消融，有这样的经验吧？咱们3个医生都应该做过。OK， 陈大夫，你先谈一谈。Dr. Chen, please.
Okay.
Looks like there's a connection problem. Professor, can we invite other doctors to discuss first, or?
Yes, Dr. Chen, maybe he can give some audience. Give some comment about this.
Okay. The most important professor is safety aspiration, the liquid in nodule.
All right.
Because when we aspiration the liquid, the nodule is easy to blood. Okay.
Bleed. Okay. Thank you.
To bleed. You mean that's a cystic thyroid nodules， 就是囊性甲状腺结节治疗的微波治疗的问题。
那个最关键的呢，就是如何抽吸那个囊性结节里面的液体，安全的抽吸它的液体，避免出血。
Yes. So Dr. Chen said, for this question from the Egypt doctor, right? So
yes.
Dr. Chen gave the key point. The first should be aspiration the liquid in the cystic thyroid tumor. Why? Because avoid bleeding during the procedure. Yeah, this is very important. I think the Egypt doctor can understand what I said in English. First, aspiration the liquid.
We can ablate the aspiration， 就是消融一个针道，消融的抽吸针道。Ablation the aspiration
tract, the needle tract. Yes.
So another key point is about ablation the track of the needle. then prevention bleeding. Yeah. Okay.
Yeah.
I think it's clear for this question, right? About Dr. Long and Dr. Tang, do you have some comments? 唐大夫和龙大夫，你们有什么建议关于这个
我用
囊性
中文
甲状腺
来说吧，
结节？
不好意思，我谈一下，确实我非常赞同陈教授的说法，就是抽液的过程中要避免那个抽液那个针头本身针道的出血。如果你一边抽一会，它又针道出血的话，其实后续的出血一样会干扰的影响你的消融。所以能用最小的针，抽液，这是一个。第二个，针道不要跨过太多甲状腺组织。如果你跨过太多的甲状腺组织的时候，在针道里面出血会更厉害，这是一点。另外我会如果抽液比较困难的，我会消融针进去以后再出液，这样呢马上把针道给凝闭掉。这样就避免到针道出血的情况。
OK， yes, good idea。
还有一个问题就是抽液过程中，我不知道大家有没有遇到一个很尴尬的情况，特别是囊壁很薄的，抽液以后囊腔好像有时会看不到了，所以抽液不要抽得太干净，或者你要换一下，灌一点生理盐水进去，避免这个囊腔很难找到的情况。囊壁的处理还有一个就是，我不知道大家有没有用，就是用点比如聚桂醇之类的硬化剂，这样会加强一下消融的效果，让它囊壁纤维化更好，以后复发的几率可能会更低一点。
好 ，Yes, I'd like to take a presentation about Dr. Long's ideas, his comments. He said important. The focus is about in puncture the thyroid nodules first, and then aspiration the liquid. Because if we after the aspiration the liquid, maybe the tumor shrinks. Not easier to give the good puncture, do good the ablation. I agree with him. And also, so after the aspiration the liquid, so the microwave ablation result is very good. Otherwise, some liquid in it, so not complete ablation, right? And another thing he said, also he has his idea about some, give some how to say 聚桂醇. I don't know how to say it in English. 聚桂醇.
Let me check it for you.
Don't know how to say the.
Yeah, I'm checking it right now.
聚桂醇知道怎么说聚桂醇 in English? I don't know because this is the Chinese.
硬化剂，对。
聚桂醇的桂是哪一个桂啊？主任？
桂花的桂，
纯
净的纯，醇那个乙醇的醇，
乙醇的醇，好的。polyphenol.
Like is a hardening agent, hard agent. 它就硬化剂啊 ，very hard 啊 ，hard agent. Dr. Tang said Dr. Long said he used a hard agent injection, and then can easier to ablation, and the result of ablation much more better, right? Dr. Tang, yeah. Also, this I think is a very good experience how to do the cystic thyroid nodules. 囊性滤泡性，我们也就叫囊性或滤泡性的甲状腺结节，所以这是一个经验。Okay, this also, very valuable, experience. Thank you.
Thank you.
Thank you. And how about Dr. Tang, the lady doctor? Do you have some comment, Dr. Tang?
汤老师，您的麦克风打开一下。
唐大夫，你的 mic。 你关着麦克风的。
Okay.
Yes.
Yes.
Yeah.
Can you hear me?
Your comment. We need your comment.
I,
For cystic thyroid nodules.
I think Professor Long's idea is very good, but in our department we haven't used the hardened age, and the cystic nodules. The most important step is to extract the liquid, as the Professor Long have said. So I think all the procedure should avoid bleeding or and protect the important tissues such as arteries and trachea. And yes, that's my opinion.
Okay. You said so. It's very important to do the procedure. Do you think the hard agent is good? Do you have the experience for the first injection hard agent
No,
and then
actually,
do the
actually, in our department, we haven't used the hard agent.
You never use it. Okay.
Yes, we never used it.
How to do the procedure if you have the cystic thyroid nodules? How to do that?
We just extract the liquid in the nodules. And
just
then we just extract the liquid, and then we insert the ablation antenna.
Okay.
Okay.
Okay. That is aspiration, and then you can do the procedure because you use the liquid to separate the tissues, vessels, trachea, and the tumor, right? Between that, right? Okay. Thank you. Thank you very much. Are there any comments on the questions? Not all?
Professor, yeah, I have a question because I remember observing one thyroid cystic nodule ablation cases, and I remember that after aspirating the liquid inside the thyroid, the doctor was injecting alcohol to wash away the inside of the cystic nodule. So do you also perform, like the other doctors, do you also perform the alcohol injection before doing the ablation, or you just skip the step?
That means for the alcohol, pure alcohol injection, right?
I don't know how many percentage of the alcohol that was, but they did.
Alcohol as the agent, hot agent, right?
I think so. Not sure about that. That's why I wanted to know if the other doctors do the same in their practice.
No, we didn't do the same. We never use alcohol.
就是刚才那个唐大夫提到了用聚桂醇，那么 Donna 刚才提到，比如说酒精、无水酒精，它也是硬化剂，是吧？是不是可以代替 ？Okay, that's another question. I think it's good.
Yeah. Okay. Thank you. So
I think, in my opinion, if you have the different hard agent, pure alcohol, it can be the hard agent. We know. Another one is the 聚桂醇 in Chinese. Yeah. So I think the 聚桂醇 is much more safer than alcohol.
Yeah.
Be careful. Yeah. That's my opinion. Thank you.
I see. Thank you, Professor.
大家注意啊，这个聚桂醇比那个酒精要安全的多。OK， 那么我宁可选择聚桂醇。OK， Are there any questions or comments?
Yes, we have some more questions. There's one question regarding the local anesthesia. How do we control the amount of lidocaine in the surgery? 我们怎么控制这个利多卡因的用量？
Okay. So I think it's easier to answer for all doctors. Please, who would like to give the comment? Answer. How to control the volume of the lidocaine during the procedure? Okay.
Less than 15 毫升
milliliter.
15 15
15
millimeter.
or 50? 15 or 50?
15.
15.
15.
15 毫
Okay, 15. Okay, not 50. Be careful. Okay.
Okay, just the follow-up question. What would be the proportion of the local anesthesia liquid? 利多卡因的配比应该是多少
1比3。1, 2, 3.
Like that
1
means
比3。
1比3应该怎么？So the 3那是一个生理盐水的比例，然后1是利多卡因，对吗？Okay, so one third lidocaine and 2/3 the saline solution.
But I think usually you can use the pure lidocaine, but sometimes you give the half.
Half.
Half. Yeah,
Okay.
that's okay. That's enough. Because usually the 2% of the lidocaine. So we gave the half, then the 100%. That's enough for the local anesthesia.
Okay.
Is that right?
Okay.
Yeah.
Yeah. Thank you.
About the
我想请
volume,
问一下
I think according to the tumor size, according to how do you separate the tumor between the tissues. And not only maybe someone we want to keep the organ, for example, trachea, esophagus, vessels, nerves, but pay attention to anterior of the nodules because there's some subcutaneous, there's some small vessels, small tissues. If you separate it, also very important. Otherwise, adhesion.
Yes.
For example, Dr. Long said adhesion. Sometimes after the microwave ablation, the subcutaneous adhesion is stronger. So, the surface looks after the surface mean the neck looks not so beautiful. Or be careful about that. That's my opinion.
Yeah, right.
So that means the separate with the liquid, not only the posterior but also anterior. If you want to do the procedure, that's more important. Because some young doctors, that's the nodules, that's the benign nodules. Why they want to do that ablation? Because they want to keep their neck beautiful. So
cosmetic purpose.
Yeah, as Dr. Tang said, some maybe we needn't do the nodules, but some doctors, some patient ask doctor to do, ablate. They keep because there are some, for example, one day I meet the young lady. She's a dancer, She's a dancer. She should keep her neck beautiful, but there are some, nodules. Thyroid.
Okay.
So I did the ablation and become beautiful. Yeah, she's happy. That's right.
That's the benefit of minimally invasive ablation therapies. Okay, so moving on to the next question, they also asked about the proportion of the isolation liquid. That means apart from saline water, do we need to add some lidocaine in the isolation fluid? 就是打水隔离的时候，这个液体的配比，就是说除了盐水之外，我们还需要加多少比例的一个利多卡因吗？
一般在前包膜它会感觉到痛的话，要加利多卡因。后包膜嘛，防止这个把核反神经给误麻醉了，我们一般就是用纯的生理盐水。
OK。好的，我来翻译一下。So about the question of the proportion of the isolation liquid, if we are ablating the nodule in the front capsule side, if the patient is feeling pain, we would add a certain amount of lidocaine. 不好意思，主任是多少比例的利多卡因？如果要加的话。
要是1比3或者1比1。
1:3或1:1 Okay. So 1/3 or just 50% lidocaine proportion with the saline water to prevent the patient from feeling pain. But if we are ablating the nodule in the back of the capsule, we do not recommend to use we do not recommend adding lidocaine into the isolation liquid because it may numb the recurrent laryngeal nerve. So the patient may if we hurt it, the patient may not feel it. So we do not recommend for that. Okay, thank you, Professor. Thank you.
Okay. Thank you.
Okay, it's good.
Okay.
I think that there is another question from the Kazakhstan, 是吧？哈萨克斯坦。Yeah, there's a doctor from Kazakhstan in our neighbor. The doctor said how to do the follow-up after the ablation procedure. How to do the follow-up. But just now, I think some doctor gave us their opinion about 1 month, 3 months, half year, 1 year. I heard about that. The follow-up and gave them, they maybe they do the ultrasound examination or just look the tumors become smaller and disappeared, shrink. So that means the internal, the follow-up internal time, please.
So.
Okay.
The first follow-up usually is after 1 week or 1 month. Then we follow up check patients after 3 months. After 3 months, we check patient 6 months. 6 months. Okay.
That means 1 week, 1 month, 6 months is your opinion, right?
Yeah.
How about other doctors?
And 1 month, 3 months, 6 months, 1 year. 1 week, check for what?
Okay. Dr. Long said his opinion.
Yeah.
1, 3, 6, 1 year. Yeah.
1 year. Yes.
1, 3, 6 months and 1 year. Okay.
After 1 year, we check patient, follow up check patient 6 months per time. 明白？就每半年一次。
是3个月之后。
就1年以后 after 1 year, we check
1 year,
patient.
then
Every
after 1 year, how about later?
6
How long?
months. Yeah.
I mean, Dr. Chen, you said after 1 year follow up, then how about the patient? Continue to follow up or give up?
Yes, continue to do the follow-up every 6 months after 1 year.
Oh, that means after 1 year, then 6 months,
Yeah.
right? Okay.
Yes.
Okay, I think Dr. Long had a question. So if you're following up after 1 week after the ablation, what is your purpose? Like, what is your focus in this follow-up?
做那个回访主要是为了检查什么东西？
一直是检查他的并发症。
Complications.
Yes.
Okay, good. Thank you.
还有什么问题吗？这就是个煎熬啊！
Dr. Tang, do you have the same routine for follow-up?
We the follow-up is in 1 month, 3 months, 6 months, and then 1 year.
Okay. So it's pretty much similar.
Yes.
Okay.
Yeah, the follow-up time, no big difference.
Yeah.
Okay, good. I'll move to another speaker, another question. Donas?
Okay, we have one question from Ukraine. So this doctor says, thanks for giving, thanks for the great webinar. Let me find out if PET scan should be done before ablation, and have you ever met any lymphostasis after node ablation? 就是消融之前会不会做PET 扫描，然后做消融的时候有没有遇到过淋巴结消融后的一个淋巴结的瘀滞？
那会不会做 PET 扫描？
一般不做 PET CT， 一般做 CT check chest or brain。
OK，
我觉得我们对于甲状腺的消融，一般都是这个低度恶性的肿瘤或者良性肿瘤。
好的。那他后面的那个问题就是说，有没有遇到过淋巴结消融后的一个淋巴瘀滞的问题？
没有。
Okay, thank you. So to answer this doctor from Ukraine, normally they do not do PET CT before ablation. They would just do CT for chest and brain. And no, they have never met any lymphostatics after node ablation. Do we have different?
Why they do PET CT before the ablation? I think the microwave ablation is used for the benign tumors. So if the tumor is benign, you don't need to do PET CT because it's very expensive, and also it cannot guide it for your therapy because you just need the microwave ablation to cure the benign tumors, I think. So you don't need to do PET CT. And if the tumor is benign, there is no no lymph nodes that you should to ablate.
Okay.
Yes.
Thank you.
Dr. Tang, and the lady doctor said it's good. So usually we think ultrasound examination for the thyroid tumor, thyroid nodules, that's enough. Why?
Yes.
Because compared with the CT scan, the ultrasound examination can give us more information, more detailed anatomy,
More detailed
than
information.
CT scan for the thyroid tumor nodules. Is it right?
Yes.
So I think maybe some special case they need, or the patient want to do the CT scan, then we can do that. Otherwise, I think ultrasound is enough. So for the PET CT, if you suggestion the metastasis to other portion of the body, bone or someplace, you can do the PET CT. We never do that. Yeah.
Yes, we never do that.
Very few. Yeah.
Okay.
So, thank you, Dr. Tang. I agree.
Yeah. Thank you. So I have a question myself. So I know that there are some doctors, they are doing microwave ablation on this papillary microcarcinoma of thyroid. So like the smaller than 1 centimeter malignant, like the cancer, thyroid cancer. So in this case, do we need to do this PET CT?
No need to do PET CT because it's just smaller than 1 centimeter. Yes, it's and that means it's PTMC, papillary thyroid minimal
Carcinoma. Yes.
Yes. So I think there's no need to do PET CT.
Okay. Thank you. Thank you, Dr. Tang.
Okay, move to next. Are there any questions? We have time, please.
Yeah, I think that is Yeah, I think that is the questions that we have now. But if that's okay, I would like to ask another questions. How like the Dr. Chen, he did a parathyroid adenoma ablation in the very beginning of the life case. So is the evaluation of the ablation results is similar with ablating other nodules in the thyroid? Like I see that you did the injection of the contrast and we see no enhancement. So is it always the standard to determine if the ablation is complete? 就是我来讲一下，对，就是因为就是我们看到第一个做的是那个那个 adenoma 腺瘤是吧？
对，甲状旁腺腺瘤，对
adenocarcinoma，
primary parathyroid adenoma。
对对对，就是因为做其他的甲状腺结节的时候都就是结束之后都注射了那个造影剂去确定是否消融完全。那针对这种甲状旁腺的，是不是也一直都是用同样的方法去确定消融后的一个效果？
对，同样的方法，最后我们造影的时候是一次性评估的。
OK， 那我想问一下，如果说一些国家没有造影剂的这个条件的情况下，我们怎么确定消融范围完全？
那这就比较困难了。
就是
还是需要造影。
就是没有办法通过一些那个它的气化的一个范围去判定，是吗？
对，最多能够通过 CDFI， 就彩色多普勒。
Okay. Thank you. So I asked
Dr. Tang, Long and Dr. Tang, what's your opinion about the evaluation the ablation result?
我想问一下谭教授一个问题，就是你不好意思，我还是用中文表达的比较好。我看到你讲的那个病例做的效果非常好，基本上最后都完全吸收了，是吧？我想问一下，第一个你我自己做的时候，我感觉我基本上看不到这样的病例，就是能够最终肿块吸收的完全消散不见了。就第一个，你的病人大概有多少比例能够达到这样的效果？这是一个。第二个，怎么样做才能够让它能够吸收的如此干净？是完全消融的就能达到这个效果吗？因为我感觉我的很多病人回来做造影了，那些他完全消融。但是要达到这种吸收的非常干净的，我看不到这样的效果，我不知道你是怎么样做的。
龙主任，那我先翻译一下可以吗？
谢谢，不好意思。
我先翻译一下，不好意思，对So I was asking Dr. Chen about the ablation evaluation. The ablation result evaluation. So in the case that we do not have the contrast enhanced facility, so Dr. Chen suggested to evaluate the ablation results by doing the 那个用什么刚刚不好意思，我忘。
怎么样去要达到这种完全消融的效果
？Okay, the color Doppler, yes. He suggested to use a color Doppler to evaluate the ablation results. That is from Dr. Chen. And Dr. Long, he just said that the life case Dr. Chen did, the result was very perfect. It looked very clean. And the nodule, the ablations seemed, right after the ablation, the images looked very clean and observed. So Dr. Long wants to know how many percentage of Dr. Chen's cases has same result. And is it that as long as the ablation is complete, that gives the effect of complete absorption. So, yeah, thank you.
Actually, there are just only one case have this because I think it depends on the nodule. If the nodule is solid, that means it's a solid nodule. I think the microwave ablation cannot just shrink to the normal. But if the nodule is cystic, that means there's many liquid in the nodule. And then we extract the liquid in the nodule, then insert a tenor of the ablation. And that also depends on the patient's, I think all the patients, every patient has the individual difference. That means different person have different 就是不同每个人有个体差异，所以他每个人的预后可能不一样。And we just happened to this one case that have this result. It depends on the nodule and the patient, I think. So
the patient's actual situation. Yeah, it can be different from patient to patient. The results can be different. Okay, thank you very much.
Are there any questions?
Yeah, we have one last question. The question is, in the papillary microcarcinoma, there are often lymph node micrometastases that we do not see with ultrasound or contrast enhanced ultrasound. So do they often cause microscopic recurrence? 做甲状腺微小癌的时候，会经常会发现一些淋巴结的一个微小的一个转移。但是这个转移的话，我们一般没有办法通过超声或者说超声造影去看到这些转移。那这样的话，他们会造成一个 microscopic recurrence， 一个微小的一个转移，会造成转移吗？
This question is complex. According
听懂他的问
to
题了吗？陈主任，听懂他的问题了吗？
我听懂，但是这个问题啊比较复杂，就是因为呢，我们做这个 PTMC 的时候啊，这个问题太复杂了，不是一句话两句话能讲清楚的。系统性的问题呢，就是根据这个甲状腺
微
癌的
小转移灶的处理，
我知道，它的就是淋巴结，你没有确定它是阴性的情况下，你就消融，它是淋巴结会不会还有存在这样异常的一个问题？
复发，
对吧？
对。
这个问题比较复杂，看看杨教授呢？杨教授看看。
So I think in this situation, the doctor, the operation doctor who'd like to decide it, how to complete or incomplete maybe some tooth ablation. We have known because the ablation area in the neck is very narrow, very limited. So we should pay attention. For example, you find the abnormal lymph node. If it's an abnormal lymph node, and it's big enough for us to do the ablation, so we should do it. Otherwise, we should pay attention. Just now, Dr. Long said, the ablation complications. Maybe sometimes the doctor think we should do more. We should do complete ablation. But the result not so good because the complication, the injury of the tissues, injury of the organs, and the complication, the adhesion of the tissues. So we should pay attention about these complications. That's important because if there is a metastasis of lymph nodes, we have time to treat them in the near future time. So for the doctor, if you want to do something, you should be thinking about the result, not now, but the near future, I think. So sometimes we should do the procedure step by step. Of course, just now you showed some cases, very interesting. And Dr. Tang said some case, the one case, yeah, very good, complete. Just one time ablation. Dr. Long said the case, just one time ablation, big tumor, but shrink. After 1 year, we cannot find anything in the neck. That's a good result. But not every case like this. They give us a typical case, So we should sometimes learn how to say no, not only yes.
Yeah.
Remember that. Then you can be continue do our job much more effective. Yeah.
Yes,
So
exactly.
that's just my comment. Yeah, just my comment. And another question, maybe some audience said, during the procedure, during we do the ablation procedure, the patient can swallow, can speaking to doctor or not. There's some question from the audience. Give the answer.
Yeah.
就当你们做这个消融过程中，假如有病人说我能不能咽口唾沫呀，能不能说句话呀？
有的时候需要通过这个说话来检测的核反神经的这样一个状况。
实际上是可以说话的，也是可以吞咽的，对不对？
而且也是需要的，有的时候。
对，唐大夫、龙大夫和那个都同意吧？陈大夫都同意这意见啊。OK， 他们有人提这个问题，这样我就顺便跟大家说一下。Okay, I think now the time is over. Now it's 6 past nearly 5 minutes.
Yes.
So if there are no other special questions, I think we can finish today's classroom, online classroom. And so other chairman and other moderator of the session, I'd like to say thank you so much for Dr. Long, Dr. Tang, and Dr. Chen. Your experience, showed us how to do the better microwave ablation for the thyroid tumor, thyroid nodules, and how to prevent the complications during the procedure, and how to follow up the patient after the procedure. I think it's a good lesson for me and for all of the audience. So I hope, I should like to say thank you so much for all of you gave us contributions. And as an old doctor, for me, I think all of you should continue to do your job. You did a good job, but you should continue. And another thing, I hope you practice more about your English. Otherwise, now we are very close about the classroom. If in the international conference, so the English pronunciation is very, very important. You can say simple words, but pronunciation should be clearly. Okay, that's my advice. That's for you. Yeah. Okay. Anyways, thank you so much for donor. Yeah, she is good organizer. And
thank you, Professor.
I hope to see you again in the near future.
Oh, yes, definitely.
Okay, I say bye-bye. Thank you so much.
Okay, thank you. So the session is at the end. Yeah, thank you. We would like to thank all of you for your participation. And if you have more questions, don't forget to email us. And we appreciate all the speakers and moderator, Professor Yang, for the excellent work today. Thank you, Dr. Tang, and thank you very much. Okay, bye-bye.